Hi, I'm Masi, Doctor of Physical Therapy and board-certified orthopedic clinical specialist. I'm also the owner and clinical services director of Bay Area Physical Therapy and Lafayette Physical Therapy. Today we're going to talk about how a sedentary lifestyle can impact your health. Nowadays in general, people are much more sedentary. Kids are playing on more technology, screens, TVs, video games, tablets, and less active outside. They're not running around and playing with other friends quite as often. Also, adults, we tend to have more desk jobs, and now, since COVID, a lot of us are working at home in less than ideal workspaces, poor ergonomic setups, etc. Sitting all day can lead to a myriad of different musculoskeletal issues. We can end up with tight muscles, such as your hip flexors from sitting so long. They become shortened, they adaptively shorten, and thus become also weaker. When muscles are shorter than they're ideally supposed to be, or if they're too stretched out, they actually are weaker muscles. Our core and our glute muscles, our buttock muscles, we're just not using them as much. And all of these different changes can lead to muscle imbalances that can lead to pain. Aches and pains, complaining of upper back pain, hip pain, lower back pain, shoulder neck pain, headaches, so many things. Also, the sedentary lifestyle means that we have a decreased cardiovascular capacity. Overall, our cardiovascular health is not being challenged, so our heart isn't pumping as strong, getting that oxygenated blood through our bodies. Our lungs aren't taking in the oxygen. And what we end up noticing is when we do try to go back and be active, we might be more out of breath or more fatigued, and we know that that can lead to more injury. We're not prepared for that increased load. One statistic that we know is that on a cellular level, strengthening can take 6 to 8 weeks. If you look at those sarcomeres of the muscles under a microscope, we don't see them actually bulking up and changing for about 6 to 8 weeks. But if we are sedentary and we're not working out and challenging these muscles, we can start losing strength and having muscular cellular decline in 7 days. That's crazy, how long it takes us to get stronger and how fast it goes away. But that's also why most of us are not looking like the fit, muscularly ripped people that we hope to be. What I encourage is that you take time every day for some sort of physical activity and some stretching. I want you to try to get your heart rate up to build that cardiovascular strength. Generally speaking, if you can get your heart rate up for about 20 minutes every day, 5 days a week, we know that that proves to benefit your cardiovascular system. And what do I mean by getting your heart rate up? Some quick and easy measurements to do so is to try to get your heart rate to 60 to 80% of your max heart rate. So if you take 220 minus your age, it's a very gross estimate of your maximum heart rate, and then 60 to 80% of that, when you're counting your beats per minute or using your Fitbit, you want to make sure you're in that target range for about 20 minutes, 5 days a week. Also, especially if you know you're sitting at a desk and you're having all these muscle adaptive changes and tightness that can be happening, some form of stretching. It doesn't have to be structured yoga or anything like that, but it could be. But some time to undo those shortened positions, stretching out your neck muscles, rolling on a foam roller, even just sitting on the floor and playing with your kids down there. You can sit in ways where maybe you're sitting a crisscross applesauce or sitting with your legs out in a V, and you're going to start to notice, ooh, my hamstrings are a little tighter than I remember. So making sure that you pay attention to all of these different aspects of your health to avoid those negative effects that a sedentary lifestyle can have. Also, if you once were active and then you took a break, whether that's due to injury or time, and now you're trying to get back into your sport, please don't return to sport too quickly. I'll usually tell people to return at 50% of whatever they were doing before and work their way back up. So if you're going to the gym and maybe you were leg pressing 100 pounds, start at 50 and do your 50% of the sets and reps you were doing before, then see how you feel the next day. It might be too easy for you, but it's better to be safe than sorry. You want to work back up slowly. If you return to your active lifestyle too quickly, that's where sometimes I'll see patients who have acute flare-ups, the tendinitises. Anything with the itis is that acute inflammation. And then sometimes that can sideline you even longer or dissuade you from returning to activity, and now we have an even longer, more chronic problem to address. So if you need help in guiding you to avoid a sedentary lifestyle or get you back on track now that you've recognized maybe you have been a little bit too sedentary, please call our front desk for a complimentary consultation and we can set up an evaluation as soon as possible. Thanks so much.